Did you know that a blood clot can strike without warning? And when it does, it can be deadly. Every year, over 900,000 people in the United States alone are affected by blood clots, and 100,000 of them don't survive. But what if you could catch the signs early? What if you could save your life or the life of someone you love? This is not something to ignore. Today, we'll uncover the alarming signs of blood clots that most people overlook. Plus, we'll explore risk factors, prevention strategies, and the latest scientific research, so you stay one step ahead. Watch till the end, because this information could be the difference between life and death. First, let's break it down. What is a blood clot? Scientifically known as a thrombus, it's a clump of blood that turns into a gel-like substance, blocking circulation. This can happen in your deep veins, known as deep vein thrombosis or DVT, or travel to your lungs, causing a pulmonary embolism or PE, a situation that can be fatal in minutes. Imagine a traffic jam in your bloodstream, cars stuck, honking, going nowhere. That's what happens when a clot forms. But here's the terrifying part. It can happen to anyone. Let's get straight to the point. How do you know if you have a blood clot? Here are the alarming signs you should never ignore. 1. Swelling. Sudden swelling, especially in one leg or arm, is a huge red flag. The clot blocks blood flow, causing fluids to build up. If your leg suddenly swells, don't just brush it off. This swelling is usually not symmetrical. If one leg looks noticeably larger than the other, that's a warning sign. The swelling may start gradually or appear suddenly. It might worsen throughout the day, especially after prolonged sitting or standing. The affected area may feel heavy, tight, or even achy. Some people describe the sensation as a fullness in the limb. In severe cases, the swelling can extend beyond the calf to the thigh or even into the foot. If the swelling doesn't go down with rest or elevation, seek medical attention. It's important to compare both legs. If one looks or feels significantly different, take it seriously. Even mild swelling that persists should be checked by a doctor. Alarming sign number 2, redness and warmth. If the skin over the swollen area is red or warm to the touch, that's your body screaming for help. This occurs because the clot is irritating the blood vessel, leading to inflammation. If you notice a red streak along your vein, seek medical help immediately. The skin may also appear darker than usual or have a bluish tint. You might experience itchiness or a mild burning sensation. The warmth can be subtle or feel like a fever in one spot. Redness may spread over time, especially if the clot worsens. Sometimes the skin over the area becomes firm or shiny. You may feel tenderness when you press on the area. This symptom is often mistaken for an infection, which delays proper treatment. If your skin looks or feels different and the changes persist, don't ignore it. Get checked. Sign number 3, pain or tenderness. Pain that starts as a dull ache but doesn't go away could mean trouble. Many people mistake it for a muscle cramp. Big mistake. The pain may intensify when you stand or walk and could feel like a sharp, pulling sensation deep in the muscle. If pain persists, don't ignore it. The discomfort may start in the calf and gradually move upward. You might feel a throbbing sensation, especially after resting. Some describe it as a Charlie horse that won't ease up. Unlike a regular cramp, this pain doesn't go away with stretching. Pain may be worse at night or first thing in the morning. If the area is also swollen or warm, it's a major red flag. Walking may become uncomfortable, making you limp or favor one leg. In some cases, the pain is mild at first but worsens quickly. Ignoring persistent pain could have life-threatening consequences. Alarm sign number 4, chest pain and shortness of breath. If the clot travels to your lungs, it can cause sudden chest pain, shortness of breath, or even fainting. This is a medical emergency. Call 911 immediately. The pain may feel like a sharp stabbing sensation, and you might experience rapid heart rate, dizziness, or even coughing up blood. These are signs of a pulmonary embolism which requires immediate treatment. The pain may worsen when you breathe deeply or lie down. You may feel tightness or pressure in your chest. Shortness of breath may come on suddenly even while resting. You could experience lightheadedness or an unexplained sense of doom. Some people mistake the symptoms for a panic attack. If you feel weak or confused along with chest pain, seek help fast. The longer you wait, the higher the risk of severe complications. Even mild chest pain with difficulty breathing should never be ignored. Now let's talk about the science behind blood clots. Research from the CDC, Mayo Clinic, and American Heart Association has shown that blood clots are a leading cause of preventable cardiovascular deaths. Studies indicate that 1 in 4 people worldwide die from conditions related to blood clots. Research highlights that certain genetic mutations like factor V Leiden significantly increase clot risks. Experts emphasize that prolonged immobility, whether from bed rest, long flights, or sedentary jobs, can double the likelihood of a clot forming. New medical advancements are helping doctors diagnose clots faster through D-dimer tests, ultrasounds, and advanced imaging technology. Recent trials show that blood-thinning medications and lifestyle changes can lower clot risk by up to 80%. Another study found that staying hydrated and moving every hour can cut clot risks in half. Breakthrough research is also exploring gene therapies to prevent clotting disorders. With science advancing rapidly, early detection remains the key to survival. The evidence is clear. Knowing these risks and warning signs can save lives. Now you may be asking who's at risk of getting blood clots. These factors increase your chances of developing a deadly clot. Obesity. Extra weight puts pressure on your veins, slowing blood flow and increasing clot risk. Obesity is a major contributor to poor circulation, as excess fat compresses veins, making it harder for blood to flow freely. This leads to increased pooling in the lower limbs, where clots commonly form. Studies have shown that people with a high BMI are significantly more likely to develop DVT. The risk is even higher in those who are sedentary or have other risk factors. Losing weight, even modestly, can improve circulation and lower the chances of clotting. A balanced diet and regular physical activity are essential for reducing the impact of obesity on blood clot formation. Prolonged inactivity. Sitting for long hours, like during flights or desk jobs, allows blood to pool in your legs, making clots more likely. Long periods of inactivity, such as traveling on a plane or sitting at a desk, slow circulation, increasing clot risk. When the calf muscles aren't used, they don't help push blood back to the heart, leading to stagnation. This is why travelers are advised to move their legs frequently during long flights. Office workers are also at risk if they sit for extended periods without movement. Even watching TV for hours without breaks has been linked to an increased risk of blood clots. Taking regular breaks to stretch, walk, or do simple leg exercises can help keep blood moving. Smoking. Smoking damages blood vessels, making it easier for clots to form. Tobacco contains chemicals that make blood stickier, increasing the likelihood of clot formation. It also damages the lining of blood vessels, leading to inflammation and narrowing of arteries. Studies have shown that smokers have a significantly higher risk of DVT and PE compared to non-smokers. The risk is even greater for women who smoke and take birth control. Quitting smoking can drastically reduce this risk and improve overall cardiovascular health. The longer you smoke, the more damage is done, but stopping at any time can start the healing process. Birth control or hormone treatments. Estrogen increases clotting factors in the blood, raising the risk. Women on birth control pills or hormone replacement therapy have a higher chance of developing blood clots. The increased estrogen in these medications raises clotting factors, making blood more likely to form clots. The risk is even higher for smokers, those over 35, or individuals with a family history of clotting disorders. Some birth control methods carry a lower risk than others, so it's crucial to discuss options with a doctor. Symptoms like leg pain, swelling, or shortness of breath while on these medications should be taken seriously. Surgery or trauma. Major surgeries or injuries can trigger clot formation, especially in the legs. When the body undergoes trauma, it responds by increasing clotting mechanisms to prevent excessive bleeding. This is beneficial in stopping wounds from bleeding, but dangerous if clots form in deep veins. Post-surgical immobility further contributes to clot risk, particularly in orthopedic surgeries involving the hips or knees. Patients are often given blood thinners or compression devices to reduce this risk. Moving as soon as possible after surgery and following post-operative care instructions can help prevent complications. Myths and facts. Think only the elderly get blood clots? Think again. Even young, healthy people can be at risk, and what you don't know could be deadly. Some say crossing your legs causes blood clots. Others believe only long flights put you at risk. What's the truth? Let's bust the myths. Because knowing the facts could save your life. Blood clots kill more people than breast cancer, AIDS, and car crashes combined. Yet myths keep people dangerously unaware. Let's set the record straight, right now. Only the elderly get blood clots. False. Blood clots don't care about your age. They happen to athletes, young adults, even teenagers. Fact. Sitting for long hours, dehydration, birth control pills, smoking, or even genetics can increase your risk, no matter how young you are. Imagine this. A 25-year-old marathon runner develops a clot after a long-haul flight. Fit and healthy, but still at risk. Crossing your legs causes blood clots. Well, if that were true, half the world would be in danger every time they sit down. Fact. Crossing your legs doesn't directly cause clots, but sitting for long periods without movement can. That's why long flights, bed rest, or even working a desk job can be risky. Solution? Get up, stretch, walk around. Your blood flow will thank you. Myth number 3. Blood clots are easy to spot. Wrong. Many people never realize they have one until it's too late. Fact. Some clots have no symptoms at all until they break loose and cause a life-threatening emergency like a stroke or pulmonary embolism. That's why prevention is key. If you experience swelling, pain, redness, or warmth in one leg, don't wait. See a doctor ASAP. Myth number 4. Blood thinners completely eliminate clots. Not exactly. Blood thinners don't dissolve clots. They only prevent them from getting bigger and forming new ones. Fact, your body slowly breaks the clot down over weeks or months. But stopping medication too soon can be deadly. Always follow your doctor's advice. Myth number 5. Only long flights cause blood clots. Sure, long flights can be risky, but what about Netflix binges, road trips, or sitting at your desk for hours? Fact. It's not just flying. Any prolonged sitting without movement increases your risk. This includes working from home, gaming marathons, and even hospital stays. Pro tip: move every hour, stay hydrated, and if you're at higher risk, talk to your doctor. Blood clots don't discriminate, and myths can be dangerous. Share this video with someone you love, because what they don't know might put them at risk. Hit that like button if you learned something new today, and subscribe for more life-saving health facts. Now, let's talk about the powerful, natural ways to keep your blood flowing smoothly and reduce your risk of dangerous clots. Eat blood-thinning foods. Your kitchen might just hold the key to better circulation. Foods like garlic, turmeric, ginger, and cinnamon contain natural compounds that prevent excessive clotting. Turmeric is a golden spice that contains curcumin, which has been scientifically proven to reduce blood clot formation and improve circulation. Studies show that curcumin works by reducing platelet aggregation, meaning it helps keep your blood flowing smoothly. If you want a simple way to incorporate turmeric into your daily routine, check out our video on the amazing benefits of drinking turmeric water. Click the link on the screen or in the description below. Leafy greens like spinach and kale provide vitamin K, which helps regulate clotting. But balance is key. Omega-3 rich fish like salmon and sardines keep blood slippery and flowing smoothly. Eating a diet high in processed foods and unhealthy fats can thicken your blood, making clots more likely. So, swap out the junk for whole, unprocessed, nutrient-packed foods to protect your health. Stay active and move often. Sitting is the new smoking, especially when it comes to blood clots. Sitting too long slows circulation, increasing clot risk. Every hour, make it a habit to move, even if it's just stretching or wiggling your toes. If you're on a long flight or road trip, try calf raises, ankle circles, or short walks to keep your blood moving. If you work at a desk, set a reminder to stand up and stretch every 30 minutes. Your legs and heart will thank you. Hydrate like your life depends on it, because it does. Think of your blood like a river. Without enough water, it slows and thickens, making clots more likely. Drinking plenty of water daily keeps blood at the right consistency. Dehydration thickens the blood, increasing clot risk. Too much caffeine or alcohol can dehydrate you, so be mindful of how much you consume. If plain water isn't your thing, try infusing it with lemon, cucumber, or berries for extra flavor and health benefits. Now that you know the dangers, protect yourself. Know your risk. If you have risk factors, talk to your doctor about prevention strategies. Want more life-saving health tips? Hit that subscribe button and turn on notifications so you never miss out. Don't forget to check the video on turmeric water.